psychopaths, like, literally throwing kitchen tables. And she was like, what? I'm like, follow my lead. We're going out the fucking window. We did electroconvulsive therapy.
Did you just say shock treatment?
Oh, yeah.
Bro, what?
Yeah.
Y'all do lobotomies too?
No.
Damn.
Do you want to quit or do you want to be fired? And I said, you want me out of here? Fuck you. Fire me. She goes, okay, fired. And I was like, wait, what? You have to take that patient. Why won't you go? I said, because it was a drive-by. There are fucking bullet holes in the door, and he lived. You think they're going to drop that? The fuck? Are you kidding me right now?
What's up, Internet? Welcome back to the URL vs. IRL podcast. This is Casey here, and today we are having a great conversation. We are going to be talking to a veteran nurse. 34 years in the game. She has just finished up. Not only was she a nurse, but in her free time, she mastered the art of fuck around and find out parenting very well. And you will get to see the source and the reason behind why I curse like a sailor. We are talking to my mother.
Girl, you're getting so fucking good at these intros. Let's roll the music. Steph, welcome to the podcast.
Thank you so much for having me.
Yeah, I'm excited to have you. How are we?
We are good. How are we?
I'm good.
All right.
Man, this is crazy. I'm so excited to talk to you. You said you've never been interviewed before?
I've never been interviewed, and I'm nervous because there's a fucking microphone in my face.
Well, if it makes you feel any better, it's not like a job interview, even though it kind of is, because we're
Yeah.
talking about your job, but it's not like we're going to like accept or deny you. So if that
But
makes you
you've
feel any better.
taught before.
I've taught, I've spoken at a national sales conference
That's
in
what
front
I
of
mean. Oh my God,
400
you
people.
stop.
It's a professional me. This is like, I don't know.
well,
like,
you're
us
retired
here.
now,
Like a new
so you can
platform.
say whatever the fuck you want.
Oh, I'm
Truth.
I did that in the job as well, which caused me a bit of trouble.
Yes, you are a fuck around, find out mom
Fuck
and
around
nurse.
and find the fuck out.
That's what I'm talking about. Okay, to start us off, I love having people like give us a little intro story just to kind of reel us in a little bit. Can you tell us about your craziest interaction you've ever had with a patient?
All right. So the craziest one was when I was a student in my wound ostomy and continence nursing program. So I had to do 120 hours of supervised practice with a preceptor. And I was working with my friend Jackie doing a home visit in Germantown in Philadelphia. So it was a consult on these two elderly patients who were basically just vegetables in their hospital beds in the dining room of this decrepit row house.
Ugh, I
So-
can smell it.
I could smell it too. And both of them had been referred to Adult Protective Services for multiple bed sores, which was the reason that we were going. So we go up, and the house was on the end of the row. So we go up the steps, and then up some more steps to the porch, and their son lets us in. And we see the patients, we smell the patients, and they both had multiple wounds, so it was a long visit. So the son's like, okay, I gotta go, you guys are good? And we were like, yeah, we're good, we'll figure it out. So we're there for over an hour to see the two patients. Comes time to go to the front door. The door is locked.
No.
With a key. Not the turning kind of deadbolt.
The key on the inside of a door?
Key
That's
on
terrifying.
the inside of the door.
That's
Because
fucking
why?
scary.
So we yell up to the grandson, hey, can you come down and let us out? I don't have a key. And we were like, the fuck?
What do you mean you don't have a key? You
He
fucking
didn't-
live here.
He didn't have a key. He didn't live there.
Oh.
He was just there. We don't get a lot of backstory on all the
Yeah,
people
you
that are
never
living
do.
in homes when we go to see patients. We, most of the time, are just kind of winging it.
Okay.
So we're like, well, when's your dad going to be back? I don't know. Can you page him? We didn't have cell phones. Can you page him?
This was back then?
Yeah.
Terrifying. What do you fucking mean?
No, he usually comes back in an hour or two. And we're like, it's 3:00, Friday afternoon, corner row house in Germantown, which
Where
was,
shit's gonna get popping.
shit was already popping. So I looked at Jackie. She looked at me. She's like, we should call the police. I'm like, we're not going to call the fucking police.
You don't want to
Like,
be that person.
I don't want to be that person. And they're not coming even if you call them.
Exactly. They're not coming, and you're good as well dead if you call the cops,
Right.
and they know you call the cops. Like,
Good context for
never.
listeners. Anyways, continue.
So I yell up to the grandson, you know, well, can you call somebody else to come with a key? He was like, yeah, I don't know what to do. I don't know what to tell you. Break the front window. And I'm like, I am not busting through this guy's window. Like, absolutely not. So Jackie's getting nervous, and I'm like, all right, there's a side window in the dining room where the patients are because it's the end of the row. But because we had so many steps to go up, it was like not quite a full story to get to the sidewalk, but it was
High enough.
doable.
Yeah.
But the house was falling apart. Like the window frames were rickety. You could see through the plaster and lath to the brick. You could see outside from the inside. Like this house was falling apart. So I'm like, we're going out the window. And she was like, what? I'm like, we're going out. Follow my lead. We're going out the fucking window. So
Yeah.
the windowsill and the framing was so rickety. And I'm like, oh my God, this thing's going to fucking crumble and I'm going to plummet down. So I'm like, it'll be all right. It'll be all right. So throw our nursing bags down. I'm like, all right, I'm going to go first. Hold the jam, hold the frame.
Yeah, to
like,
make sure it
put
doesn't
pressure
fucking
on it,
fall
make sure I
apart.
don't drop. So I like maneuver myself out the window and I'm like hanging like this, trying to like lessen the impact. My toes caught on one of the like window grates for like the basement windows, and I was able to like kind of like shimmy down the side. And then I'm like, all right, Jackie, you go. I'm like, I'll catch you. And I'm like holding my hands out. She's like petrified, crying. I'm like, no, like this is your only choice. I'm out. You have to come out now. You cannot stay in this house by yourself. So she finally got herself out, and I'm like, God, this is fucking crazy. And we look to the corner, and there's just a crew outside the corner store. Like these two fucking crazy white bitches are breaking out of the house. But like didn't bat an eye, just kind of watched it all unfold.
Like,
and I'm like, dude, we need a fucking drink now. Like,
yeah.
the work day is now over.
Oh
I
my
don't drink,
God.
and I would have needed a fucking drink at that point.
I'm like,
It's insane.
but like, thinking back to the things that we did as just part of our job, no cell phones. Didn't have pagers early on.
Yeah.
It was use a patient phone or use a payphone if you needed help.
That's so
That's
dangerous.
crazy, especially because you were going into people's homes. It's not like you were in a hospital setting, which, I mean, we know there's like such unsafe conditions for nurses in a hospital setting.
Yeah.
But like, what do you think is like a story that you have about like unsafe situations in nursing, I would say? Like,
Well, I can't really speak to hospital nursing because I only worked in a hospital for a year and a half after
okay.
nursing school. But I did that work on a psychiatric floor, and we had staff injuries that were a regular occurrence. At one point, we had 6 nurses that were out with injuries related to restraining patients.
crazy.
Yeah. Because they admitted you for psychiatric care at University of Pennsylvania Psychiatric Department as long as you had good insurance.
Right.
Didn't matter whether you would have been better suited for a forensic unit. Didn't matter whether we had enough staff or we could even help you. If you had good insurance, they were bringing you in. So we had forensically, medically ill or mentally ill patients.
Like criminals.
Criminals. They
Yeah.
should have been in like Norristown State.
Right.
On the unit with elderly dementia patients
Right.
who were restrained in their jerry chair, and the psychopaths like literally throwing kitchen tables and
Right.
wielding pool cues, because we had a pool table on the psych floor, because that's a great idea.
Oh my
Also,
gosh.
we had a smoking lounge because that's how long ago it was on the psychiatric floor.
Wow. So
Yeah.
what year when did you go to nursing school? Like, can you give us like years? Do you know?
So I started nursing school in 85 and graduated in 89, winter of 89. And I worked on the psychiatric floor from 1990 to 1992-ish. And then I went into home care. And the rest of my career was in home care in some capacity.
Did you like hate being at the hospital?
Yeah. I was very naive when I started out.
I feel like most nurses would be as they're starting out.
Very naive, very gung-ho,
Yeah.
very, I'm going to help people.
Yeah.
We're going to have therapeutic interactions. Well,
Yeah.
no, the fuck you're not. You're
That's
gonna,
what everybody thinks.
You're
Yeah.
going to tune them up and you're going to send them out with a list of phone numbers to call and make appointments. And they're going to come back in a month because they can't access the care they need. This was back in, the early 90s, and it's only gotten worse with the mental health system.
I
with our
can't wait to
medical
hear about
system in
that.
general, the accessibility to quality medical care in general
Right.
has never been great. I mean, the fact that we don't have access to equal health care to begin with
No, it's
is
disgusting.
astonishing.
It's disgusting.
I mean, the fact that I think it was like Alex had like a chest x-ray, and after his insurance covered it, it was still over $1,000.
That's insane.
I just paid $3,000 for my knee surgery because I have a high deductible plan and I get like assistance to afford my health care because I'm not covered under an employer plan now. $3,000 fucking dollars.
It's insane.
Like,
It's a lot just to get the care that you need.
You've seen the evolution of nursing from, let's say, 1990 up until 2024 when you've retired.
yes.
You've seen the evolution of nursing from the 90s through now. What are some of like the biggest changes that you've seen, like the biggest evolutions?
I mean, just the evolution of technology and care. When I started as a nurse, universal precautions was just becoming a thing. The nurses that I worked with who had been in their role for years never wore gloves to start IVs. Blood and body fluid contamination wasn't a thing. So I was in nursing school right when the whole HIV/AIDS thing was
that's
evolving.
right.
Whoa.
So I saw the whole evolution of universal precautions, awareness of bloodborne pathogens. When I started in nursing, IVs were not administered with pumps. We had the bag. You spiked the bag with the tubing, and you had a little roller thing, and you calculated how many drops per minute would deliver the amount of drug that was ordered for the patient.
So you had to do real life math and
Had to
science.
do fucking algebra, dude.
Right.
What the
Okay, so
fuck?
algebra actually came in handy for
The
someone
only
for
time.
fucking once.
The
Right.
only time in my entire life.
Yeah.
Yeah.
At least
So-
you could say you used it.
Yeah. We used to not have unit dose drugs come up from the pharmacy. If you needed to administer oxycodone, there was a lockbox on your floor. The charge nurse had the key. You went in the lockbox, signed out what you gave, and at the end of each shift, incoming shift and outgoing shift, one from each would reconcile your narcotic count.
Shut
And
the
I'm sure
fuck
that's
up.
changed a lot with the opioid epidemic.
I mean, it's not a thing anymore.
Right.
Things, drugs come from pharmacy, unit dose per patient. Everything's barcoded and scanned.
But does that
Yeah.
change and cause a delay in time? Like if you need medication like urgently to give to someone and
like in the ER they have stuff there.
Right,
But it's
okay.
also like scanned and barcoded. They scan your wristband now.
Yeah.
Like there was no computerized, there was no electronic medical record. We documented on paper. Even when I started home care, everything
Wow.
was paper charting.
I remember your paper charting.
Oh my God, I had fucking tubs and tubs
Yeah.
of documents.
Holy shit.
It was ridiculous.
How much, like,
yeah, HIPAA wasn't a thing.
wow.
Crazy.
You could call, somebody would call when I was on the psych floor. Oh, hi, this is so-and-so calling for this person. And how are they? Oh, and we'd give information. Oh, you're a family member? Yeah, absolutely. Yeah, they're doing good today.
I can barely get my own fucking medical records right now. Like, that's insane to think about.
Right?
Holy shit. You know, I have a question for you, I guess, because I have a friend that's recently a new nurse, like literally as of this year. She graduated school, got her first job. I think now she moved to a different hospital or something. But how much did you feel like you were just like thrown into the fire coming straight out of school and then trying to actually go into nursing? I think that like the general public would probably think like, you guys have so much training. Of course, you know exactly what the fuck is going on as soon as you get there. It should be like second
No.
nature.
You don't. And I can't speak to how it is now.
Right.
But when I was in nursing school, your senior year, you did like an elective clinical rotation. And that was often where you went to practice for your first job. So you got a lot more hands-on. But now there are preceptorships. So if you're a new nurse in the emergency room or a new nurse in the ICU, they link you up with people and they're longer orientations once you get to your job placement.
Okay.
So, but you come out of nursing school and you may not have been taught certain clinical procedures. Like
Yeah.
I went through my entire 4 years of nursing school and never started an IV and never drew blood. Yeah. So, and
Did
I
you
also,
feel like you were going to kill someone the first time that you drew
no,
blood?
because I went to psych and they like, you know,
Okay.
you have a nurse there and when you're in the hospital and that kind of setting, it's not that fast paced thing.
Right.
So, oh, cool. We need to get this lab And I can't remember where we had phlebotomist teams come up and do our blood work. I think we probably did, but we did put IVs in people who went down for shock treatment. So, and it wasn't like...
Did you just say shock treatment?
Oh, yeah. We did electroconvulsive therapy.
Bro, what?
Yeah.
Y'all do lobotomies too?
No.
Damn. That's unfortunate.
But ECT was definitely an effective treatment for like resistant depression.
Okay.
Some of that.
Casey.
No, I mean like catatonic resistant, like people who are basically just not functioning at all, like laying in bed.
Yeah.
Period.
But like, that's not used anymore, right?
It is used, but it's not like One Flew Over the Cuckoo's Nest where they bring you down wide awake and just fucking jolt you with electricity.
Right.
You're under anesthesia when you go for that. Thus the IV access. So we would put the Heplock in on the psych floor. Worst part of it was taking their dentures out of their mouths. You can't have anything in your mouth like loose dentures when you go down because ECT, it creates a seizure activity in your brain. And that, to my understanding, affects the neurotransmitter.
Is that why we're not allowed to even have like jewelry in at all when you go under for surgery?
Like oral, like piercings.
Like any kind of,
they're very particular about if they need to put an airway in or if you've loose bridge work or anything.
God.
But so they anesthetize you now. So you're unconscious when you have the shock administered, and the seizure, because they give you certain meds, your whole body doesn't like have convulsions. The seizure activity is in the brain.
Okay.
And so it's a more humane way of treating it. How did we get onto that topic?
You were saying that you were starting IVs, sending people down.
So that's how I started IVs.
Right.
But I was on the psych floor, so it was more like passing meds. And
it's not like an emergency, like trauma unit kind of thing.
My wiring is not for that kind of adrenaline setting and practice.
Yeah.
Because I went from psych to home care, also not a high intensity.
But still high acuity as far as like social determinants of health.
Absolutely.
Right, exactly.
Which is still just as much as a health crisis.
It is, but I'm not in a position where I might kill somebody if I miss a crucial piece of data.
Right.
That was always my thing. My brain on the fly, like I was so worried that if I'm in the ER and I like fucking misinterpret something or make a med error or don't understand a lab value like that, someone's going to fucking die. Yeah. And I can't have that. I can't live with that.
Yeah.
So I kind of gravitated towards the more slower pace.
Yeah.
But definitely you still have to think on your feet.
Do you think that that's what made you choose that career path in nursing versus like going to the emergency room? Because I've learned recently that there's like so many different avenues that you can take within nursing.
Nursing is so diverse.
Yeah.
You can practice in almost any arena. But people are kind of geared, like neurology is wired towards certain things. If you're an adrenaline person, if you need to be physically active and moving around fast pace, you're an ER nurse, you're an ICU nurse, you're an OR nurse, you know?
Wow, that makes sense.
I'm not that.
I have a question for you.
Yes.
I'm sure that you've heard this so many times throughout your career before that like nurses are inferior to doctors. How do you feel about that? Because I feel like that's probably how the general public looks at nurses a lot of the times. Even when like you're going to like a general doctor's appointment, you're dealing with a doctor and then like a nurse practitioner. Do you have any like, I don't know,
opinions?
Yeah.
No, I've never had an opinion in my life.
I know you got some shit to say.
It's like comparing apples and oranges. Nursing and medicine are not the same thing.
Okay.
It's not a hierarchy of medicine's here and nursing is here. Medicine is the treatment of disease.
Okay.
Nursing is the treatment of the human's response to illness.
How long did you think about that before I asked you that fucking
question?
I
like that.
Run that back.
Yes.
Medicine is the treatment of disease. Nursing is the treatment of the human's response to disease.
Oh, yeah.
So I'm managing the human. I'm taking care of you as a human. And that I saw early on, because I was always, as a little kid, like, I'm going to be a doctor. I'm going to be a doctor. I'd watch ER on repeat as like a young person. I would look at my dad's anatomy books from when he was in dental school.
I was just gonna ask you.
Memorize, all the different like Latin words for blood and the different like bodily fluids and like spout them off like I was fucking something. But like I always wanted to be a doctor. That was just the thing. And then my senior year in high school, we had to do a senior project and I was a candy striper. You know what candy striper is?
Yes, I do.
The fucking red and white pinafores. the little white stockings.
Yep.
And I saw firsthand what nurses do
Yeah.
in the caring of the patient. The doctors come in, make their rounds. You got them for 2 seconds at the bedside. They rattle off some orders and on they go.
Yeah.
It's the nurses that are there feeding the patient if they can't feed themselves, managing the ventilator, doing the suctioning if somebody's got a mucus plug in their trach, putting a catheter in. Like, it's so personal.
Yeah.
And you can't just focus on the disease.
And what I was going to ask you is, because, I mean, did you ever feel, because you said you grew up saying, I'm going to be a doctor.
Mm-hmm.
Did you ever feel like there was pressure from Mom and Pop-Up because Pop-Up was a doctor and because Uncle Brad was becoming a doctor? Like,
The lore.
We got lore.
Thank
we
you,
got
Casey.
lore.
We got lore, for sure.
But like, do you feel like because you grew up in a family of, I know they were dentists, but like they had the title of a doctor.
Yep.
Like, do you feel like that added like a layer of pressure onto like your career path?
I didn't perceive it as pressure early on. I just thought that's what I was going to do. And I was even like pre-med my freshman year, and it just didn't fit. Nothing about it fit.
Yeah.
That's good that you recognize that, though. And the other thing that I was going to say, I guess, to what you were saying originally, is that I feel like we take nurses for granted because so many people get so, like, I remember even my mom used to be, like, frustrated that, like, you get no time with the doctor. Like, when I was, like, sick, she's like, the doctor spent no time with you. You just talk to the nurse the whole time. But, like, to realize that the nurses are actually the people that are really taking care of you and the doctors are just, like, looking at the symptoms and using their brain to figure out what you need to cure those symptoms is wild.
Yeah.
And there's so much cross information that you knew. Like,
Oh, absolutely.
You knew.
Yeah.
I'm sure there were times where you could probably school certain doctors in certain situations of like just the experience that you had.
Also,
Like,
because you get like a deeper understanding of what's really happening with this person and like what's wrong for them. You know what I mean? Yeah.
Yeah, I mean, the two roles are collaborative. They're
Of
that's
course.
what I was gonna say.
should be collaborative.
Yes.
Let me
I was gonna say, I
rephrase
watched
that.
you have a very collaborative relationship with doctors where like you had clout in what you were doing. So
Oh,
like
absolutely.
you were respected by doctors.
You earn that over time, and you have to demonstrate your proficiency in an area before you get that.
Of course.
And some of it is also how you present it. But one of the most important roles of a nurse is to advocate for their patients. So if something's happening and the doc's not aware, or, I mean, you don't want to throw anybody under the bus, but if they're fucking up,
Right.
you have to advocate for your patients. I mean, there were times where I sent a patient back 4 different times to the emergency room after a surgery because I was absolutely convinced that he had a complication called a fistula internally from his bowel cancer surgery. And the surgeon kept sending him right back home. And I begged the family to take him to a different hospital. Begged. No, the doctor knows. They must know. She's a great surgeon. And I'm thinking, no, this is wrong, until he collapsed at home and they brought him in to the same hospital and then had to fly him down to HUP because he had perforated his bowel.
Wow.
Yeah.
So
That's
is there,
fucking crazy.
That's insane. Yeah.
But I mean, had I just said, oh, the doctor must know, everything's
Right.
fine. I'm like, no, you have to go. You have to go to the
Right.
ER. Refuse to leave. Fucking don't leave.
And like, do nurses have any recourse when there's like situations where it's like, you know, something should like be done a certain way and it's like
I was just
people
gonna ask
aren't
that.
fucking adhering to what should be done, or like,
or does it feel like there's like a hierarchy where it's like, I can't challenge them because of blah, blah, blah?
So you want to come at it, you have to sometimes sideways it from a collaborative standpoint. Part of it is knowing the doc that you're dealing with. Some of them are just like, I'm doctor, you nurse, this is how it is.
Right.
The worst offender of that was a surgeon who had been a nurse before she went to medical school.
yeah.
And she
oh
fucking
god,
Yeah, because you know
hated.
everything, of
I'd
course.
call, she'd hang up on my ear on the phone. Fucking just, I'm the doctor, do what I say.
Get the fuck out of here.
Yeah, and I'm like, not gonna fucking do what you say. I'm
Yeah,
gonna
all
try
proof me.
and get this patient to see another doctor. So
Right.
there's avenues you can try to talk to a nurse practitioner or a physician's assistant if you feel they'll be more receptive. And that was a great thing about working with Penn Medicine for so long is I got to know these people in the department. So I didn't necessarily have to bother the surgeon.
Okay.
If I called Mary Scott at GI lab or whatever, or the GI practice and needed something, she was like, absolutely. I'll let him know that's what you're doing. Not
Good.
I'll ask him. I'll let him know that you called and this is what you're doing.
Yeah,
Right.
that's fucking great.
Yeah, I had a head and neck surgeon tell me, like, just do it. Just send the orders. I'll sign them. I tell my patients, same with the one of the ER trauma docs down at Penn, like, I tell my patients to listen to what you tell them to do.
Mm-hmm.
If they have a wound, you tell them to do this, and they will do it, and I will sign your orders.
Mm-hmm.
So you were, to clarify that, like, you were very niche in what you were doing.
Oh,
You
yeah.
were wound, ostomy, and continence.
Yeah, so that's a specialty certification within nursing.
Okay.
And what is ostomy? What is incontinence?
So wounds, obviously, like surgical wounds that open, bed sores, things like that. An ostomy is a surgically created opening somewhere in the GI or urinary tract for the purpose of eliminating waste. So if you have colon cancer, you might wear a colostomy bag. So your feces comes through an opening in the abdominal wall and you wear a bag. So there's a nursing specialty to help people select the right appliance to wear or teach them how to care for themselves after that. So that's what an ostomy is. And then incontinence is the inability to control your bowel or bladder.
Okay.
So it was so niche. So, like, were there practices of nursing that you grew out of touch with because
yeah.
you were very niche?
I hadn't drawn blood or given an IV or done a trach suctioning or even taught diabetes care really comprehensively since I got that nursing certification. So yeah, it was more focused.
Yeah. Which is, like, I feel like awesome to have that niche focus, but, like, I guess if you wanted to stay more, like, did you have to retake, like, any general licenses or certifications on, like, general nursing?
No.
Okay.
No, you have to do 60 hours of continuing ed every 2 years
Okay.
to recertify your nursing license. But that looks like,
webinar.
Ordering the booklet, filling out the evaluation. Like, it in no way makes me competent to, like, if I wanted to work in a hospital, I would need intensive, like internship to be proficient in my skills again.
Right.
Mm-hmm. That makes sense. Did you feel like you got burnt out when you were working at the hospital originally?
You mean when I was on the psych floor?
Yeah, when you were on the psych floor, yeah.
I actually left behind a patient safety issue.
Oh.
Yeah, so remember I said those people were all out with work-related injuries from restraining a patient? So we had 2 units, a locked unit on the 11th floor and an open unit on the 10th floor. I worked on 10.
Okay.
The nurses were out on 11, and one day no nurses showed up for work on 11, and 2 nursing assistants showed up for work. There were no nurses on the floor. So we'd have our morning meetings. Yeah. It was like a sick out kind of dealie, I think. But there were people injured. So in our morning meeting, the nurse manager was like, okay, we need 2 people to go up and staff 11 today. Who's going to go? And we were like, it's full census. There's like 13 patients up there. One of them's in the isolation room. One was in locked leather. Like it was high acuity up there. And so as a group, we said, you know what? Send us all up. Send all 5 of us up to care for these patients and then pull from somewhere else for the less acutely ill patients.
Because you're all already trained in psych.
We're already trained in psych.
Right.
So we were all told, no, it's not our place to make suggestions. Just if we didn't decide who was going to go, they were going to send 2 of us up. So we all were like, absolutely not. It's not safe. There's all these injuries. This is why.
Yeah.
So she sent all 5 of us home from work. So now 5 of us are suspended for 3 days without pay for refusing to take a patient assignment. This is my first job. I am just 22, 21, somewhere in that ballpark.
Yeah.
And I'm like, what the fuck is even happening right now? But we're all standing together. It's great for patient safety. So I do my 3-day suspension, and then we get called into the clinical director with the head nurse of the psych department. Called us in one by one. 3 days are up. You're ready to accept your assignment. And we all had been talking like, no, we're going to stand together for patient safety, staff safety. Mm-hmm. Are you ready to accept your assignments as they're given to you? And I said, well, I have a nursing license, and part of that obligation with that license is to evaluate the assignment and make sure that it's safe for myself and my patients. So if I deem the assignment to be unsafe for either of those things, I'm unable to accept it. Well, I'm going to ask you again. Are you ready to come back to work and accept the patient assignments that you're given? Repeated the same thing. And then she was like, well, do you want to quit or do you want to be fired? And I said, you want me out of here? Fuck you, fire me. She goes, okay, fired. And I was like, wait, what?
Oh,
The
shit.
fuck?
Yeah.
Like, my first nursing job and I'm fired? Like, fucking fired. I've never been fired from a job before. I was like, all right, I'm fired. And I left. And I'm like, I'm fucking fired. Like, I have an apartment. What am I going to have? A car. What am I going to do? Everybody else accepted their assignments as they were given to them.
And that makes you a true fucking punk, Mom.
Yes.
That really does.
Stick it to the
that was
fucking
horrible.
man.
So somehow, I think the husband of one of my coworkers who accepted her assignments as they were given wrote a letter to the board of the hospitals or board of trustee dude whose daughter was a psych nurse also, as an aside, also a addict stealing narcs from the psych floor. Different story. But somehow I was unfired after 2 weeks. Very naive. Didn't even ask, like, what about back pay?
You just needed a job.
Get me back to work. Like, I was panicked. How do I tell my parents?
Yeah, I was going
got
to ask
fired
what
from
you
my
did.
first fucking.
But then you went back. Right.
Yeah.
Mary would have caved for that ass.
So I went back to work and started looking for a new job.
Okay, smart.
That was my exit from hospital nursing and my first dealings with the University of Pennsylvania Health System.
Okay.
So I feel like your reason for leaving was probably like that safety issue is part of a much more bigger discussion of systemic faults in the medical system.
Absolutely.
Are we able to talk about like the medical system in general a little bit? Because I know you've got words for it.
I got words. I mean, safety's been an issue from then to now, and it's not improving.
But I mean, like, do you think that like the medical system as a whole like doesn't give a fuck about nurses?
Not one fuck.
Yeah.
Not one fuck. It's lip service.
Can you dig into that a little bit?
Yeah, gladly.
I can't wait.
Gladly. Oh, where to start with this? I mean, I've had incidents where I've had to go to patients' houses not knowing that there were safety issues due to poor communication.
And in layman's terms, like safety issues, like in what general?
So either there was family members, caregivers who were abusive physically or verbally to staff, also to maybe the patient, sent to homes. I'll give you a good one. I got a consult to do see a patient in South Philly, a gunshot wound. You know, go see this patient. He's got wounds after his surgery from his gunshot wound. So I roll up to the house, look at the door. It's fucking bullet holes, front door. I keep on driving.
Yeah.
Call my office and say, unsafe location to provide service.
Yeah.
We can't take this patient. You have to take that patient. We've already accepted the patient. We need you to do the consult. Why won't you go? Other nurses have gone. I said, because it was a drive-by. There are fucking bullet holes in the door, and he lived. You think they're going to drop that? The fuck? Are you kidding me right now? I don't care that other nurses are going. They shot up a whole fucking house in the middle of a block.
And he's still there.
And he's still there. And
He
he
didn't
lived.
move.
He didn't move. He's
He's
alive.
fucking dead.
And now I have to go in his fucking house.
I'm not going in his fucking house.
Yeah, no, fuck
Will
that.
you see the patient? I said, all right.
Tell him to come to the fucking. Tell him to come to us.
He's paralyzed.
Oh,
Because he
fuck.
was fucking shot in the spine. One of the bullets hit his spine.
Fuck.
Yeah. So I call him and I said, listen, I'm the wound specialist. I'm supposed to see you, but I noticed there's some bullet holes in your door.
Yeah.
I'm a little concerned for your safety and my safety in case, something were to go down again.
Yeah.
Is there another place that you can go that we can provide your care? Oh, I can go to my aunt's house.
Ding, ding.
See you tomorrow there.
Yeah, no
Just
bullet
fucking
holes
think
there.
on your feet.
Right. That's
But
insane.
the pressure from the managers, oh, you have to go. Other nurses went. Why are you the problem?
They're not even
went.
thinking about like why did he get shot? How did he get shot? Where did he
Right.
get shot? They're just like go treat the wound.
Blah, blah, blah. I'm just a drone. I'm going to go slap a bandage on without thinking about anything else.
Good for you.
Like, use your fucking brain.
Right. Right. Yeah, that they really, it doesn't seem like they gave a fuck about you. And I'm sure that's just one instance.
There was a million. I have left homes where I've gotten a sense that something's off with this person, this caregiver. I had a patient who was basically on life support in her home, and her husband just, his whole life was centered on providing her care. And it was really sad, but he was agitated.
Right.
He was like pushy when I called. I just got a vibe like, oh, this visit's not going to be really great, whatever. Telling me where to park. You sure you're coming at this time? Yes, I will be there. And I am spot on my times. I give you an hour window when I'm going to show up. And it is rare, unless I have a medical emergency at a prior patient, I am within that hour window. It's not fucking rocket science.
Yeah.
Park my car. Walk by him. I don't know it's him because it's my first visit. He's walking down the street. I'm walking to the house. Go up on the porch, knock, wait, knock, wait, knock, wait. Waited like 5 minutes. I'm like, can't get in. Started walking back to my car. He's like, oh, are you the nurse? And I'm like, didn't I just walk by you?
Yeah.
He was like, yeah, I wanted to get my steps in. And I said, I told you when I was coming.
Yeah.
He was like, yeah. And I'm like, well, you fucking wait, dude. Like,
I gave you an hour window, which means that I told you ahead of time.
We're already on the wrong foot.
Right.
And he was like trying to like twist my words around my evaluation of her. And I don't remember the details of the visit, but he kept walking out of the room and going into the kitchen, and I could hear him talking to himself and getting louder and louder and louder. And he'd come back in the room and his motions were getting bigger and bigger. And I'm like, I'm out. I said to myself, well, I see that, we're not really going to have an understanding here. And why don't I just get in touch with your doctor and give the doctor my recommendations? And he was like, you're all the fucking same, all you people. And I'm like, and I just started working my way out the door.
Because you had to know that wasn't about you.
Well, I totally know.
Yeah, like that.
But also, I looked through the chart. There were no documentation of his behavior being unsafe. So I called the nurse and I said, I had a really weird visit with this patient's husband. Oh, yeah, he's a little off. And I'm like, so
thanks for the fucking heads up.
Thanks for the fucking heads up. So I called the doctor and said, his behavior is irrational, it's unstable, and it's unsafe for us to be providing home care because of the way he's acting. They're like, oh, this is the first we're hearing of it. Cool. I ain't going back.
Right.
So that was like my default. Like, you might not be able to refuse a referral from the health system. Like, we at Penn Medicine Home Care could not turn down a patient referred from a Penn hospital.
Okay.
Period.
Okay.
And there's a lot of them.
Safety issues be damned. They're not saying no. So the patients, if there were to be a safety issue, for instance, a husband of a patient threw a chair at one of my colleagues while she was pregnant, hit her with the chair in his fit of rage because she said his wife needed to be hospitalized. And he lost his shit and threw a chair at her. Not the first time this guy was abusive.
Clearly.
He had been on service, like, this family had received service like 9 different times. And instead of like saying, all right, cool, we can't provide care. This is unsafe. We can't provide care.
Yeah.
They referred her to hospice, Penn Hospice. And I guarantee you that hospice nurse didn't get word one about his behavior.
Right.
Oh, God.
So it's lip service and it's bullshit. I could go on and on for an entire podcast about safety. And
that's fine.
care.
You're on a podcast right now. Feel free to dig in.
And talking about the system, about how, again, like how they don't give a fuck about nurses. Do you think like the way nurses are treated is like based in patriarchy? Because nursing is inherently like a female-based role.
I think that's part of it. That's definitely part of it. I mean, I remember sitting for my nursing boards back in 1989 or early 90 in the Armory in Northeast Philly in a giant hall with my little Scantron carded pencil because nothing was computerized, and the proctors were yelling at us to be quiet, and if you can't follow simple directions, how on earth will you ever follow the doctor's orders when you're a nurse if you can't follow these simple directions? And I'm like, do I really want to be here? Like,
right.
It was very much the doctor was God and you are the servant to carry out God's will.
Mm-hmm.
And do you think that like followed suit with like males fitting into like the doctor role, women fitting into the nurse role? Like that seems to be like the roots of that dynamic is like the male woman. Like
There are so many male nurses now.
right
and
now,
Good.
I think that is shifting, but especially in our older populations, like, I mean, I don't think my parents would have ever questioned their doctors.
Right.
no, never.
I mean, no, the generation just didn't. You did what you were told. Doesn't matter whether it was right. Doesn't matter whether it was working or not.
I feel like we're just now starting to get to the point of actually being able to like question sometimes. And I think that the internet probably has a big part to do with that, because a lot of us think that we know so much because of like all of these things that we see on the internet. And like, you know, there's different like shows and stuff like that that you think that you have like an insight into as is what this actually looks like on a day-to-day basis, but like we really don't.
Yeah,
You don't. And there are people that have different degrees of like actual literacy and then health literacy.
Yeah.
And one of my favorite things is when I get a patient who's very well informed and they want to know and they ask me a bunch of questions. And am I doing this right? What should I ask the doctor? And I always tell my patients, like, when you go to the doctor, if you're about to get some information that's like you really need time to process, bring someone with you. Bring a list of questions and make sure you get them answered. And if the doctor is not willing or able to take the time to answer the questions, you need to consider a second opinion or a different doctor. Like, don't just take the brush off.
right.
Oh, well, he's a great surgeon or she's a great surgeon, but I waited 3 hours to see them with an appointment and they were only in my room for 5 minutes.
Yep.
Unacceptable.
It happens all the time though.
All the time.
All the
I've
fucking
left
time.
practices for less, medical practices. When I was pregnant with her, I went to the doctor because I had to get a referral from my HMO to go to the OBGYN for my pregnancy care.
Okay.
Made an appointment, showed up on time, waited an hour in the waiting room, waited a half an hour in the exam room. He came in and handed me a lab slip to go get blood drawn. And I said, are you fucking kidding me right now? I've been here an hour and a half. You could have told me that I need blood work and I could have picked the slip up at the desk and had it drawn by now. I want you to take my blood now. Well, we don't get paid from that. I said, I don't fucking care. I've been here an hour and a half.
Yeah.
An hour and a fucking half. Took time from work. My job is every bit as important as your job. That's the way it is.
And that's like the norm.
I know. I'm like, oh, cool. I left that practice immediately. Fuck
Good.
you.
Yeah, good for you.
Fuck you.
That's like such a standard though. Like even is something like for something simple like you're like going to the doctor for, and you're like, I'm gonna be stuck here in the fucking waiting room for like an hour, and then I'm gonna be waiting for them for like a half an hour. You know what I mean? And I think that probably also goes back to like what I was saying earlier, is like even watching my parents get frustrated being like, we've been here for this long and we only got to see the doctor for this amount of time, and not realizing that the nurse is really the person that's like really taking care of you in a sense and is like listening to you and what's going on and all that kind of thing.
Yeah.
It's a shame. I feel like you guys got taken for granted.
A lot of nursing is taken for granted until you're a patient. And then you see. And the patients that you care for are truly grateful for the care. My dad and my mother, I was well into my 40s, and I would still get you could always go back to medical school. And I'm like, I'm in my 40s. Like, I have an established career, a professional reputation. I love what I do. And you still see that as less than. You know when that changed for my dad? When he had diverticulitis and needed a colostomy. And then had a wound infection. And he actually said to me, thank you. I see why what you do is so important now.
And that's huge coming from a man like that.
Absolutely.
Like, that means moon and stars.
Yeah. And I also called him out on the fact that he made my mom take care of his colostomy, because he's like, I can't see it. I can't see where it is in my belly. And I'm like, Dad, I taught a blind lady how to care for her colostomy, so don't fucking give me that bullshit. You just don't want to do it.
I mean, it's got to be, and this is me asking because it's purely, I'm your daughter, but like being a nurse and knowing what you know about medicine and health, how does that impact your role as like being a mom?
No, it's fucking horrible.
Are you kidding me? She said, let me
get comfortable.
Because I feel like my relationship with that would, like, you would tell us and be like, oh, it's fine, you're fine. But, like, in your brain, you're probably fucking reeling.
It was so hard. I thought I wanted to be a pediatric nurse until I did my pediatric clinical at Children's Hospital of Philadelphia and cried every day that I was there. It was horrific. And I cannot imagine being a pediatric nurse and a parent.
Right.
Like, my hat goes off to those nurses.
Why was it so horrific for you? Like, just quick example.
They're children. Dad taking his son in a custody dispute, ended up taking his kid, kidnap, whatever, took his kid, and they were in a horrible car accident, and the kid was burned up, and I had to change the bandages on his fucking burned hands.
Oh. No, I couldn't do that.
Yeah, child.
Awful.
Yeah.
Childhood cancer.
Yeah. That's where my brain went immediately. Yeah.
Yeah. Yeah, those are the two examples. But I had you had croup as a baby.
Oh, God.
Which is like that gasping, coughing, like barking seal sound. And I know what to do for croup.
Right.
You put them in the cold night air or a steamy shower, one or the other. But I'm calling the pediatrician in a panic, and in the back of my little nurse brain is epiglottitis, an acute pediatric emergency requiring tracheotomy, is like loud, and I'm like crying and like holding my coughing infant while I'm waiting for the doctor to tell me that she's got fucking croup and it'll be fine.
But like, I remember you being a savage and like taking Zach to his pediatrician's house on a Saturday morning.
No, that was your dad, because he had a fucking MRSA on his leg.
But like, we were like making house calls. Like, you would just call our fucking doctors and be like, no, you're seeing my kid.
Oh,
like,
yeah.
Like, I remember I got bit by a dog when I was younger.
Oh, that was awful.
My mom called in a fucking plastic surgeon.
Wow.
Totally did. So I'm seeing patients in home care in the city of Chester.
Okay.
She's what, 2, 1.5?
I was two.
Good for you for not being afraid of dogs. Anyway.
I was about 15.
Yeah.
Oh, okay, gotcha.
She's at the golf course with her dad, blah, 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 in the clubhouse with a bag of potato chips, and the dog that was owned by the family that ran the golf course, like, attacked her and, like, mauled her face. So I get a call from her dad. Oh my God, Casey was bitten by a dog. I'm headed to Phoenixville ER. And I'm like, I'm on my way, and do not let any motherfucker touch her face. Ask for Dennis Montero. He's a plastic surgeon. If he's not in the hospital, ask them to page him at his office. Do not let a general surgeon touch her face, because I didn't know the extent of it.
Right.
But I did know the state of the surgical team at Phoenixville Hospital, and I didn't want any fucking parts of that. So I drive from Chester to Phoenixville. I made it in like 25 minutes.
That's
it's
crazy
like a 45-minute drive.
Okay, got it.
And I go in there and I'm like, where is she? Well, she's like toddling around the ER with her like bloody face. And I'm like, okay, so there's not like major injury. But fucking Dr. Montero came over from his office because I had seen his patients before and sutured her face. It's awful when it's your kids.
I'm sure.
Awful.
Yeah, it has
But I
to
feel
be.
like having, like you said, like having those thoughts of like, oh my God, is my kid gonna need a trach when you know it's just a cough? Like, oh my God, is my kid's fucking orbital bone fractured because she got bit by a dog? Like,
Oh yeah, when
you know what
your
I mean?
brother smashed his eye on the stairs going into the garage. He was 18 months. We were coming back from a doctor's appointment with ear infection medicine, and he like crawling up the stairs and missed and smacked his face, and his eye split like a melon. And I called the doctor. I'm like, don't close. I know you're closing in 15 minutes. We're coming back.
Holy
I mean,
shit.
it's a good thing that you at least like had the connections and had the knowledge that you did, because we were like frequent flyers with emergencies in our family.
I'm just like thinking about how much worse that has to be than somebody that's like constantly on Google and like WebMD trying to figure out, like, it's like my stomach hurts and it's like you're gonna die in like 5 days. You know what I mean?
Awful.
Like it has
It's
to be so
awful.
much
It's
worse.
so
even
hard.
Yeah.
How about when you had an allergic reaction in my car?
Oh,
and
that was fucking
We're going
bad.
into anaphylactic shock, and
To
I'm
fucking
thinking,
what?
I'm allergic to Compazine, which is a nausea medication.
She was having IV treatments for migraine, and one of the 4 meds that she got was Compazine, and she had a mild reaction in the treatment center, and then they thought it was to one thing, but it really was to the Compazine. And after her last treatment, we're like 2 blocks from home. You said to me, you said, my throat feels funny. And I was just getting off the exit and I'm pulling
Yeah, I
down
remember that.
Washington Street and I look at her and she's like starting to drool and going,
No.
and I'm like, what the fuck do I do? Like, what the fuck do I do? I'm like, can I get her to the hospital in time? If I lose her airway, I have nothing I can do for her.
Right.
If I lose an airway. If I call 911, I have to wait for them to get to me. But there's a firehouse with ambulances over on Green Street in Royersford.
Yeah, it was a few
so
blocks.
I flew through every stop sign and light, beeping my horn,
Yeah.
pull up to the ambulance bay.
I don't remember any of
No,
that.
she was like passing out in the car. They don't come out. I go in and I'm banging on the door. I go running in. I said, my daughter's having an anaphylactic reaction. She's in my car. They come flying out, put her in the ambulance. I said, I'm following you to Phoenixville. They're like, you won't be able to catch us. We're going lights and sirens. And I'm like, oh my God. I said, I'll meet you at the hospital. So I go to the hospital. I go in the ER. Oh my God, my daughter was brought in by ambulance, Casey Trimber. No ambulance has come in with Casey Trimber. And I'm like,
Did you get there before them?
I left them and something happened. She coded and I'm here and she's dead. Like, what the fuck? Start calling her, text. Fine, no response. And I sent 3 texts and then she goes, I'm fine. They couldn't get a fucking IV in me. We're on our way now.
Shut the fuck up.
I'm like, I left my fucking dying daughter in the ambulance. I should have gotten in there with her. Like,
Did you? Jesus Christ.
the fuck?
Do you feel like
That sounds so much more traumatizing hearing that back. I did not remember any of
Yeah,
that.
no, sure.
You're fucking blessed message consciousness.
Yeah, you're like, they couldn't get a fucking IV in me, Mom. Oh my God. Do you feel like that prepared you better for motherhood because you had so much information and knowledge?
No.
Then
Not one bit.
okay.
Because you think you're going to have all this knowledge and all, my kid's going to be in a schedule and I'm going to know how to get them to eat, sleep, poop on a schedule, blah, blah, blah. My life will look like this. Looks nothing like that.
Yeah.
There is no schedule.
That's crazy. Just hearing.
And how are you going to know that your kid's going to go into anaphylactic shock?
No, but even,
nothing's going to prepare you
just
for
the
that.
basics
No,
of
sure.
parenthood.
Yeah.
Right.
I didn't know a fucking thing. I was so filled with anxiety after I had her.
Yeah. And then you had another one after that.
4 years. Took me 4.
Okay. Well.
Didn't want her to be the only, but it took 4 years.
Yeah. Mm-hmm.
You did all right.
I did all right.
I mean,
My only requirements were be a productive human and don't be a dick.
yeah,
I've
honestly.
done
I love that for you.
I've
Yeah.
done well.
Yeah.
I'm not that much of a dick.
I mean, you're not a dick.
Eh.
Globally, don't be a dick.
No, I'm,
Right,
not,
right, yeah.
I'm not a universal dick.
Right.
Be a dick when you need to.
Exactly.
Yes, exactly. Can we dive into how healthcare is really a business?
Yes.
I feel like that's something that people don't realize a lot of the times.
It
Because
is.
who the fuck would think about that unless if you're in the industry?
I mean, the reimbursement for healthcare has changed drastically since I was started out in nursing, and it was kind of the demise of my desire to be part of the medical industrial complex was realizing that everything is tied to the finance. Literally everything.
Talk about the medical industrial complex.
So our healthcare system is part of our larger patriarchal, capitalistic, settler colonialism.
Talk that shit.
This is
Mom.
where she gets it from, podcast.
Talk that
Listen,
shit.
this is the source.
I mean, the people making the rules that affect healthcare are tied into the financial markets, are tied into the political arena, are tied into pharma. It's follow the money trail. If you want to know why something is the way it is, follow the dollar signs. Period. Care is
Hell
denied
yeah.
based on money. Access is denied based on money.
Shout out Luigi Mangione.
I mean, it's all tied into one big thing, and it's disgusting because the patient is the one that suffers.
Yeah. And we don't even realize what's going on half the
Not a
time.
fucking clue.
I would have never even thought that deep before our pre-production phone call that we had for this podcast.
It's awful. So, for example, there are private equity firms that purchase failing hospital systems. So, for example, Delaware County Memorial Hospital
Okay.
was failing.
Okay.
They were purchased by a private equity firm as an investment. So
And by failing, you mean they weren't making money.
they were on the verge of bankruptcy.
Okay.
Okay.
Not able to keep up operations.
Okay.
So these equity companies come in and they're like, "Oh, we're going to save you. We're going to buy you. We're going to put all this money into your operations. Becomes a for-profit healthcare system. It's now an asset for this equity firm. Just like your house is an asset for you. You can leverage that asset, gives you purchasing power. So these equity firms come in and they fucking take over. They infuse some cash to get them up and running, but they leverage that asset. They suck dividends out. They pull profits out. May I consult
Please,
my
I've been
notes?
waiting for the fucking notebook.
May I consult my notes?
I've been waiting for the notebook.
Because there's some figures here that I would like to share.
Hell yeah, I can't wait.
Delaware County Memorial Hospital example. Leonard Green and Partners reaped $45 million in dividends from that acquisition. $90 million went to the CEO, Sam Lee.
And she's dropping names, y'all.
Sam fucking Lee.
Count your fucking days.
And then when everything has been extracted and patient care suffers, they don't keep up the physical facilities. They operate as a for-profit business, so decisions are made from that lens, not necessarily the nonprofit arena still is operating from a financial-driven perspective, but maybe appearing slightly less so. But the for-profit, like everything has to do with the money. You know, how the staff is paid, what patients are, insurance are accepted in their medical practices. Yeah. And then once they've taken all they can take, they go. Bye. Sorry, we're selling you off. Can't afford to keep you open anymore. We're bankrupt again. But we've profited $90 million. So the Senate Budget Committee released a 162-page report outlining the detrimental effects of private equity firms on U.S. healthcare system. This is recent. Steward Healthcare CEO Ralph Delatorre was subpoenaed to appear and held in contempt because he refused to appear before this committee.
Wow.
So you know damn well if the Senate is talking about it, it's a big deal. Doesn't mean they're going to change anything.
Right. Well, here's the thing. I mean, but they're at risk of slashing Medicaid and Medicare funding. Our current administration doesn't give a fuck.
But even the prior administration, it's always just shifting from here to here.
Right.
It's smoke and mirrors. There's zero transparency.
But I think the current administration is
so much worse.
So much worse. Like, since you know the inner workings, like, say Medicaid, Medicare funding is completely decimated. Like, what does that really look like for everyday people?
It looks like people doing without health care. It looks like people making decisions of, I know I need to treat this, but I'm not going to because I can't afford to. I can't afford the doctor's appointment. I can't afford the medicine if they prescribe medicine. I can't afford the procedure.
Because, like, I was reading that, like, every single child in our country is eligible for Medicare if they have a disability.
Medicare, yes. But
like, regardless of your parents' income, you are eligible for Medicare if you have a disability and you're under the age of 18.
Yeah.
And, like, that is used, like, to my understanding, like, if your general insurance doesn't cover something, you can, like, have it covered through Medicare, have the cost. Like, if that's decimated, how many kids with disabilities or rare diseases go without fucking medical treatment? Like, and their parents can't afford that.
It's terrifying. It's terrifying.
That's so,
And the thing about these private equity firms, the hospitals that are the victims to this scheme are the ones that serve our most vulnerable population, like Northeastern Hospital in Port Richmond, Delaware County Memorial Hospital in Delaware County. Like, these are small community hospitals. People feel more comfortable getting care in their communities with maybe nurses and doctors that are part of that community.
Right.
So, and those are the ones that get taken over and then they fold. And it's sick.
Oh, that's disgusting.
It's sick. I'll give you another example about how money's tied into our healthcare system.
Yes.
So the whole opioid crisis. You've seen all the shows about the family and, how they did all their
fucking
dirt.
Sacklers.
Yeah. So I watched that Dope Sick show.
Oh, that show made me sick to my fucking stomach.
The thing that made me the sickest is how insidious pharma has become within our standards of medical care. Pain is the fifth vital sign. I can't tell you how many pain management in-services I've received where that's what you must assess pain.
Right.
You must use a pain rating scale. Pain is the fifth vital sign. That came from fucking...
Because we want to push narcotics.
Selling fucking opioids.
Because we want to push our narcotics.
And I'm like,
That's
oh
so
my
fucked.
God, that's been part of my practice. I must assess pain on a 1 to 10 scale, 10 being the worst. How would you rate your pain today? Well, why do you want to know? That's such a dumb question. Because fucking, pharma says I have to ask you this question, not because it's good care.
Right.
I mean, yeah, it's good care because if I come to see you every day and you tell me, oh, the pain in my wound is a 4, it's a 4, it's a 4, it's a 4. I come today and you tell me it's a 10. Well, something fucking changed. Maybe that wound's infected. That's how it's supposed to be used. And that's how we think we're using it. But why
Not
is it
like
even there?
what meds can we push to them because their pain is at like
That's how
this
it was
level.
designed.
Right.
And the fact that it's become an accepted part of practice and an important part of practice is managing people's pain.
Right. Sometimes I think that because I see a lot of reports and news come out about pain management doctors being fucking scam artists and pill mill pushers.
Mills. Some of them are. However, pain management can be very complex and it can be absolutely debilitating to live with chronic pain.
Right.
And
That's
to
so
have
real.
people accuse you of just being drug seeking when you have complex chronic pain syndrome.
Right.
So there's a need for people who are comfortable prescribing correctly these medicines. And because of what's been done with the pushing of opiates and the pill mills and everything and addiction, the patients who really need it can't get it.
Right, because we're not saying let's just get rid of all pain management
No.
and like stop prescribing pain meds like across the board because
Right.
some people get addicted to them. You can't do that. Because in reality, only 10% of people that use opiates ever actually get addicted to them.
Right, but the patient who lives with one pharmacy within, bus distance, the reasonable distance to get their meds, and oh, sorry, we're not going to fill your Dilaudid. We don't get that here. Why not? Because it's abused.
Because we're in a neighborhood where the demographic is more likely to abuse drugs.
Correct. So now my patient has to haul their ass from Kensington down to a hospital pharmacy
Now you got to go downtown.
to get their prescription filled, to manage their pain, to allow them to live with the disease that they have.
That's so fucked up.
That's so fucked.
That's so fucked
Yeah.
up. I know obviously you're a retired nurse now, but would you have any advice for like new nurses or people that are aspiring to be nurses?
I mean, it's a valuable profession and I loved it until I didn't love it.
okay.
And what I didn't love about it really had very little to do with being a nurse in patient care.
It's the bigger probably the system.
It's the system. And my understanding of it evolved over 34 years.
Right.
And I'm in a very similar position. Do you think that for nurses that are in the system now, that there's any merit or worth in trying to work to change the system from within?
I don't think you can change a system within the system that created it,
'Cause
that
that's
being
where
our
I'm at.
culture.
That's exactly where I'm at.
But I
Yeah.
still think it's worth trying.
Right.
And I still think it's worth advocating for what's right.
And do you think, like, for the nurses that may be, like, jaded by our current medical system, maybe questioning, like, is this something that I want to be a part of? Is there a way to curb that, to remain present and focused on what your values are in the field and what you want to do?
I do think there's a way to stay within alignment by focusing on the smaller gains
Right.
with your patients. I acknowledge the privilege that I have to be able to walk away from a very well-paying job after so long. I'm able to do that. Not everybody's in a position. People get jobs and they have to keep their jobs to be able to afford to keep their fucking roof over their head.
Right.
Yeah.
I think focusing on the reason you got into it, providing the best care that you can, trying to get to know your patients as humans, if that's appropriate to the setting that you practice in. Like, you can't in an ER.
Yeah.
You're not talking to anybody in the OR.
Right.
But home care, on the floor, the infusion center where you're giving chemo, like, you get to know these people and they become like family.
Right.
And when you treat somebody over the course of 5 or 10 years,
Yeah, I can imagine.
and especially in home care because you're in their homes.
Right.
Yeah.
That vicarious trauma and countertransference is crazy.
It can be, but it's also very rewarding. I mean, I loved it.
Right.
I mean, I loved it until I could no longer deal with the other issues. You know, some of that is me getting older and refusing to hold my fucking tongue.
Right.
Good for you though. We need more people like that.
Did it do anything? No. Could I be doing more? Yeah, I could be fucking lobbying my congressman and, you know, trying to advocate for the change in the delivery of the healthcare system that will better serve us. I think we need national healthcare. Why the fuck
Well, I mean,
not?
who's to say that you can't now on the other side of your journey get involved in coalition work and advocacy work, and now you have the time to go lobby.
Absolutely.
True, but also like not holding your tongue has to feel a hell of a lot better than just like sitting there and taking whatever it is.
yeah.
I ain't
You know what
never
I mean?
known you to hold your tongue.
I mean, there were times that I definitely, maybe didn't speak out like I should have or
Right.
like I wanted to. And then there were times that I was like, please, Lord, just shut your fucking mouth during this meeting. It's only an hour. Just shut the fuck up.
Right.
And no one wants to hear home care according to Stephanie.
Right.
Just shut it. Couldn't do it. Couldn't fucking do it.
Yeah.
There's a reason for that, though, and you
And-
might have changed some people's like mindset or the way that they thought about something by the time that they left that meeting.
Maybe.
Maybe that was the reason for that.
It didn't have an impact in my workplace like I
Right.
had hoped.
Right.
And in fact, it probably had the opposite impact. Where it's like, oh, here she fucking goes again.
Well, it's because we need more people like you. That's why. It's because
Yeah.
there's not enough of you. It's not loud enough.
Yeah.
You as one person might not have been loud enough.
Yeah,
even though,
one person speaking up seems problematic, but enough people spoke up, it wouldn't have been.
Exactly.
You know?
I don't know.
It
I
would have
look-
been revolutionary if multiple people
Exactly.
spoke up.
Possibly, but also they look at us as disposable. We're just fucking drones that,
Yeah.
Another warm body to fill the spot. Our retention in my last job was so poor, they couldn't hire qualified nurses. They started accepting new nursing grads in home health care. And to make it more safe, they had an intensive internship program where they were paired with a clinical preceptor. So they weren't seeing patients on their own for like 6 months. But when I started in home care, you had to have at least a year of hospital experience because you go into the home and it's
Different
not like
game.
you have good lighting. You have another
Right.
nurse you can ask, oh, hey, these lungs sound a little wet. Can
Yeah.
you give it a listen?
You have to be independent.
You have to know at least grossly normal from grossly abnormal. You have to know, oh, this is an impending emergency or not. You can't wait till the patient fucking collapses.
right.
And you have to know what to do with that information,
Yeah.
even though it's not like in an emergency setting. You still have to have solid assessment skills and you have to have the ability to really multitask because while you're taking care of the patient, there could be somebody fucking shooting up in the bathroom and, a brawl in the backyard. Like you,
Right.
you don't fucking know.
It's a different
It's
ball
true.
game.
Yeah.
Yeah, it's
Yeah.
totally different. My question for you, advice wise to others, and if you could just talk about your experience of like balancing your personal life and your life with the work life.
Yeah.
And how that looked for you, like as far as like finding things that you enjoy doing.
Some of that was related to my personal relationships.
Right.
Some of that was related to having younger children that I couldn't take the time to just do me
Right.
until you guys were older. And it was a bit of a learning curve, especially in home care where you are not tied to an office
Right.
or a hospital for your entire shift. So you have a portion of your work that's completed on your own time.
Right.
And the tendency with that can be to like, oh, I'll wait till my kids go to bed and then do my charts.
Right.
Or I'll wait for this, I'll wait for that. And then you're never done working.
Right.
Yeah, you
So
can't turn it off.
It was a learning process to set boundaries where work was not my entire life.
Right.
I mean, I feel like as a parent, you can't make work your entire
Right.
life.
I mean, but that happens to so many people where they like, live to work instead of working to live.
Yeah.
Yeah. it
I mean, and
happens a
I was
lot.
that way for a long time. Like that was the
mean,
most important thing.
Yeah, I remember like for most of my life, like I would say, this is my mom and she is a nurse. Like, you know what I mean? But now
Yeah.
I can say, this is my mom and she's a badass backpacker.
Yeah.
You know what I mean? And she takes care of horses and she does these other things and
Yeah.
she works at a bar. Like,
I knew all that stuff about you before I knew that you were a nurse, which
That's
is awesome.
funny.
Yeah.
Yeah, which is also good, but that's part of learning who you are as a human. I don't
Right.
think that nursing has any like special claim on people who don't have work-life balance. I think in our country we have like toxic productivity culture where
Right.
your identity is fucking your job.
Your work.
Right.
Yep.
And everything else comes second, and I think that's ass backwards.
Yeah, it is.
Do you think that some people are cut out to be nurses and some people just aren't?
Absolutely.
Yeah,
Yeah.
like
Absolutely.
you can't train someone to have what it takes to be a nurse.
You can't train somebody to have caring and empathy.
Like, that's what I say all the
Yeah.
time.
You just fucking can't. You either have it or you don't.
Right.
And there's an obligation to have a very high sense of personal accountability when you're providing care for somebody's life.
Right.
Yeah.
Period. I can't walk off my shift like I'm walking off the floor at Walmart,
Right.
stocking shelves.
Right.
And those boxes will be there waiting for the next shift to come
Right.
in. Or if they never get stacked until Friday, who cares? If I don't communicate with a doctor on a patient's findings right the fuck now, or at least in a timely manner, I might forget about it.
Yeah.
And then what? They might not get the meds
Could
they
be
need.
detrimental. Yeah.
Yeah.
Could be big fucking problems.
Yeah.
Right.
You know what I mean? If I don't finish my documentation on my charting, so we have electronic medical records now. So every single day in home care, when you see your patients, you do your charts in the computer, you sync, goes to the server. Every provider in the health system that has to encounter that patient can see your note once it's synchronized. So if I see you today and you go to the ER tomorrow, the ER doc can see my nursing note.
Right.
That's the way it's supposed to work.
Right.
But if you don't have accountability and I let my notes go for 2 days,
Yeah.
2 weeks, 2 months,
I mean, I see that in social work all the time, and then
see
you don't
it
know
in-
what's
I
happening.
saw it at my last job. How the fuck can you deliver healthcare like that?
Yeah.
You haven't finished your job. Like from a most basic, like I pay you to work perspective, I'm paying you, but you didn't do your fucking job. You wouldn't leave a hospital without finishing your charts. I don't care how many codes you had or what kind of chaos ensued. You wouldn't even think of walking off that unit until all your notes were done.
Right.
But in home care, because you're at your home or a patient's home and maybe the managers aren't, I want to say maybe not empowered, but some of it is a lack of accountability on their part to hold their staff accountable for the work. Shit's not done.
Yep.
And then when they do get around to like bitching about it, it's like, oh, we can't bill. Fuck your billing. This patient's care is suffering.
Right.
Because you're not doing your whole job.
Yep.
And that's the kind of shit. Like, you're going to get on me for chirping about patient safety and what improvements need to be made. But yet I go to see this patient and I pull up 2 weeks of nursing notes to prepare for my visit, for my consult, and the notes aren't done. So I can't see what the fuck you saw.
Yep. Yeah.
And I was just like, I can't put my license on the line for a company that can't demand that certain basic standards be met.
Right.
Damn right.
I'm like, fuck that. I'm done.
Good for you. I know we keep asking you for advice, but I have one last question
Yeah.
for you. Can you give advice for like the people, the normies, the patients that don't know anything about any of this? Like, what would you tell them about, like, I don't know, going into a hospital or like seeing a doctor? Like, do you have any like
Or like
advice?
navigating insurance.
Navigating the healthcare system
Yes.
in general.
Yeah.
I would say that if you have a problem, you know your body. If you have a problem, don't let anybody tell you that, oh, it's anxiety, it's all in your head, blah, blah, blah.
Yep.
Advocate for yourself, one. If you know there's a problem, get help, get care. If you go to a provider that's brushing you off, find someone else.
Yeah.
Your doctors are not infallible. Your nurses are not infallible. Find somebody that you feel is listening to you. And then when they give you instructions, when they give you advice, when they give you a diagnosis, make sure they explain it to you in a way that you get it.
Yeah.
Take notes. Ask questions. Come in with a list of questions and make sure that you get answers in a way that you understand. It's your right to get a second opinion. If you get a scary diagnosis, it is expected. You're not hurting your doctor's feelings by saying, I want to get a second opinion.
Right.
It's expected.
And I feel like that's something that we're not taught.
You feel like
Also-
you're insulting someone by getting a second opinion?
Correct. And like
Yeah.
I would have never thought to even like ask questions, because I think you go to like these healthcare appointments assuming that they have all the answers, but
And they're
how do you
gonna
get the
tell
answers?
you.
Yeah, how do you get the answers if you don't have fucking questions? Just like what was that that you told us about when we went to your house recently?
About how you can appeal to your insurance.
Oh, yeah.
Yeah.
If you get a denial, so often the people that are billing are not part of the doctor's practice. Like, say you go to your doctor's office and they say, oh, you need to go have like this procedure done over here. They're not part of the health system. Your anesthesia is not part of the doctor's practice. It's all billed from different people. They have to assign a code, a billing code for the insurance to pay for it. If there's a mistake in that coding, they're going to deny it.
Right.
Appeal. You have the right to appeal a denial.
I would have never fucking known that. I would have
Yeah.
been like, damn, I got denied.
Yeah. I got denied for my anesthesia. I had skin cancer surgery. I had a flap done around my eye. and that was covered by my insurance. My copay was what it was. I get a bill for $2,500 for the anesthesia. Denied by insurance. So I called the insurance company. I'm like, I find it a little unusual that this was denied. Am I supposed to be awake for surgery? Like, this seems really unusual to me. The surgery was paid for. Why is it? Okay. It looks like the billing code was incorrect. Do you have the correct billing code? No, I'm not a fucking coder.
Why the fuck would I have that? Right.
And they're like, well, call the number on the bill. Ask for the billing department, have them resubmit. So I called. They're like, oh, well, that's the code we use. What code should we use? I don't fucking know. I'm not a medical coder.
Yeah, do your job. What do you mean?
I had to call Blue Cross, and I got a rep on the phone who had to call, like, 3-way call with the fucking billing department of the anesthesiologist accounting. Not even the doctor's practice, their accounting firm that did all their billing. 3-way call so he could tell this idiot how to code to get my anesthesia covered.
See, and that's what the fuck I'm talking about, because a general, like, normie not knowing anything about medical anything, I'd be like, damn, now I gotta go into debt for $2,500 because I have to pay this fucking bill because for some reason something wasn't covered.
For some reason, because somebody didn't know how to do their job. Shocker.
Right.
Or it could have just been an honest mistake. Maybe they made a mistake.
Yeah.
Maybe that your ID number was entered incorrectly.
But who would have fucking known? Like, we don't learn that in school.
No.
Like, you know what I'm saying?
Always resubmit if you
I
get
still
a
have
denial.
a hard time understanding how a deductibles even work.
I know, I can't even read the fucking bill.
I don't even understand that shit.
Or
No,
the
seriously.
mail that you get that says, this is not a bill. Amount
then
you
why
owe.
the fuck are you
Amount
sending
you
it to
owe
me?
at the bottom.
Yeah.
Well, you may or may not be billed for this later. I don't fucking
Why
know
the
either.
fuck are you
Like,
sending
it's
this to me
so
if it's not a
ridiculous.
bill?
Because there's some, like, policy manual somewhere says that you need to be informed of what your insurance is paying on your behalf.
I don't give a fuck.
Just pay it.
Right.
Just fucking pay it so I don't have to.
Right.
So you can appeal. You can request resubmit. If they resubmit and it's denied again, talk to somebody. Call your insurance guy. Call that 800 number on the back of your Blue Cross card or whatever card you have. Get a person on the phone to talk to and say, explain this to me. I don't understand.
Break it down. Yep.
Yeah. Doctors can request a peer-to-peer review. If say I'm a doctor and I order this procedure or test or something and insurance like, nope, not covered. I can submit a peer-to-peer review. I can ask to speak to the physician advisor at that insurance company.
So you can have an actual doctor look at it instead of
doctor review of the case, not doctor to drone worker in the department that says, nope, denied, doesn't fall under this list, denied. Peer-to-peer
that doesn't
review.
have a medical degree.
That's probably paid minimum wage.
Right.
And given a list, deny anything that doesn't meet these criteria. Just deny
I
it.
think that's the scary part is like knowing that our healthcare is in the hands of people that like really may not be qualified. Like,
Well, also,
that,
they're
like,
not
the
getting
business,
paid
the
enough.
fundamental
By design. Because
exactly.
the insurance, the higher ups say,
Right.
okay, here's the list of what you can cover. And if it doesn't meet these criteria, denied.
Right.
And plus, we want you to deny 8% of claims just outright, whether they meet it or not.
That's
and you know what
bugging.
happens to the poor
Disgusting.
patient? Oh, wasn't covered. Let me pay that.
Yeah.
Let me take a loan. Let
That's
me
what
not
I'm
pay
saying.
my fucking for my medicine so I can pay towards this every month.
Yeah. That's what I'm saying. Like,
Yeah.
you go into debt for the $2,500 because you don't know any better.
Yeah. Social workers are a huge help. Medical social workers can help find funding. American Cancer Society, MS Society, Lions Club. We used to use them for home care. They maintained a medical equipment closet where you could go and purchase very, very inexpensively hospital bed, commode, wheelchair for people who didn't have insurance.
Damn.
Yeah. Yeah, there are resources. Medical social workers are humongous assets towards helping connect patients with resources.
I feel like there's also a lot of similarities between what I do in social work and like what you did specifically in your avenue of nursing
In home care.
in home care, because I feel like so much of nursing is about advocacy, like you said, which is super synonymous with like everything that social work stands for. And like
Absolutely.
I feel like since like nursing embodies a lot of social work's principles in some sort of way, which is kind of cool. I mean, I feel like it would be interesting to see like the crossover like of people, like how service delivery could improve if we were dually training people in social work and nursing.
Yeah. Yeah, it's a good point. I can tell you not a day went by in my nursing career that I didn't use the training I had as a psych nurse for my first job
Right.
in every single interaction with every single
So you
patient.
think like every new grad should do their dues in psych nursing to get those basic skills?
You get a psych, clinical rotation in nursing school, but should they? I don't know. It helps in home care.
Right.
It helps to understand people. It helps to assess like quickly what you're walking into with people's behaviors. I mean, some of home care nursing is you learn to assess things just because you're in a home. And like while I'm asking you about your medicines and your pain, I'm also looking at your environment. I'm watching you walk and realizing, is there a bathroom on this floor? You can't get up those fucking steps. How are
Right.
you washing yourself? Do you need a home health aide? Oh, do you mind if I go in the kitchen and wash my hands even though I just use sanitizer because I'm lying and I want to make sure you have food in your fridge and see the condition of things and you can't turn that off.
No, you can't. And I am the same exact way in social work doing home visiting.
Always assessing.
Do you have any closing thoughts? Anything you're like dying, itching to say you want everybody to hear?
No, I don't think so. I think I've said it quite a bit.
Hell yeah, that's what I'm talking about.
I think you killed it. This is like one of my favorite conversations we've had so far.
Yeah, same.
And I think that I'm very, I don't know. I've always been proud to say that my mom's a nurse, but this conversation is definitely something that I'm proud of.
Maybe
yeah,
I
me
do want to
too.
say one thing. I do see nursing as so valuable, and I am grateful for the nurses who are still willing to do that role and the nurses who are in training who want to improve the care of humans here. I'm grateful for that. I can't be that anymore, but I don't think that my opinion should take away from anybody else's desire because it was so rewarding for me for so many years.
Yeah. Would you have any advice for that? Me again with the fucking advice. Would you have any advice for them to avoid burnout?
Yeah. Advocate for your own self. Take your sick time when you're sick. Don't come to work sick. I beg of you.
Right.
Do not let your vacation time go unused. And advocate for yourself. Don't let your employer rule your entire life.
Yeah.
They're your job. Your patients are your first priority when you're at work. Employer, second place or third place in my book.
Yeah. Good. Yeah. We appreciate all the
Hell
nurses
yeah.
out there. Thank you so much.
Thank you.
Seth, thanks so much for coming on the podcast.
I hope I did all right.
No,
You
you did
killed it.
fantastic.
All right, talk to you soon.